Hi everybody, this is the video for the setup of the Camino with the fiber optic catheter. We're going to review both the ICP only catheter and the ICP with the EVD. So first things first, we're going to go to the Crane card and look at what drawers we need to go to for setting it up at the bedside. First drawer here, remember these are just your general supplies. So you're going to use this drawer for whatever type of EVD you're putting in at the bedside or ICP catheter. Second drawer down, remember, is the Ventriclear. That is the one that goes to the AccuDrain. We are not reviewing that here. Third drawer down is your general cranial access kit and sterile gown, towels. You most likely will need a package of towels for this setup, and I'll tell you why shortly. It's to do with the connection when we get to that part. And then the bottom drawer here is the Camino fiber optic bolts kits. So also in this bottom drawer, you're going to find this little box here. This has nothing to do with setting up the Camino or fiber optic catheters. This is a device for checking the pressure in shunts, and the neurosurgery team just asked that we keep this in a centralized location, and so therefore it ended up in the bottom drawer because it had the most room. So remember, this has nothing to do with setting this device up. So as we get into the bottom drawer here, there will be two different piles, if you will. One pile, there's a short little cheat sheet on top of it here. One pile has just one box with a green label, and the other one has two boxes, one with a blue label and then a smaller box. And this is because one is a drain and one is not a drain. So I know in healthcare we are never ever supposed to do things according to color, but this has been one of the most steady color labels that I've ever seen. So for now, if you're having trouble remembering which one is which, just remember that blue water drains. So the one with the blue label is the one that allows for drainage. Because the titles of these are not intuitive to what type of drain they are. The other thing that we do when we are stocking the Crane cart is take a Sharpie and write on here what they are. Please make sure that you know which one is which before you write on it with a Sharpie. But we have Camino ICP no drain, Camino fiber optic with drain. Okay, so those are the two kits here. And this box here stacked on top is the drain bag, and we'll take that out in a moment. Make sure both of our drain bags, the one for the Ventriclear and the one for the Camino, both come from Integra. The boxes look very, very similar, but the box that goes with the Camino ICP catheter, the fiber optic ones, has one drain bag per box, whereas the one for the Ventriclear with the AccuDrain, it comes 5 bags in a box. So just make sure you know which one you're grabbing when you're grabbing for that. All right, so we are going to switch over here and we're going to take a look at what comes in each of the packages, and we're going to talk about the setup. So when you know you're setting up a fiber optic ICP with or without drain at the bedside, you're going to want to grab your Camino. This is in the equipment room, and then the appropriate setup. We're going to go over the ICP catheter only, no drain first. One other piece of equipment that you're going to need to grab is the pressure cardioid, and I'll explain this a little bit more later, but the functionality of the Camino to the bedside monitor cannot be done off of the MMS. So we have to have an extra pressure cardioid. So grab one of those. All right, so as we look at the ICP catheter only, the physician will be managing this kit completely, but I'm gonna go over the contents of this. I'm gonna go over some little special notes to take on this, just so if you are helping out, this is not something that anybody sees very often. So I think the more people that know the information about it, the better off we all are. So if you want to come in and take a look at this package, these are the bits and pieces that come with it. When we're talking about the cranial access kit, remember that has the hand drill in it, it's got a drill bit, it's got a prep and closure kit, so it's got all sorts of stuff in it. There is one thing very, very specific to these Camino catheters that we have to keep in mind, And that is, in order to put these catheters in, we have to use the drill bit that comes with these packages. We cannot use the drill bit that comes with the cranial access kit. Now the physician should know that. However, again, because we do them so rarely, the more people that know, the better off we are. So when you're looking at the bits and pieces, the physician will drill the hole using the drill bit, and then the physician will take the bolt part and insert this that screws into the skull. Okay, so this little locking mechanism right here is what sort of opens the entryway into the bolt itself, but this will be in the bolt. At this time, once the bolt is in, the physician will be ready to insert the ICP catheter. Now, there is nothing to flush, there's nothing to get ready. Nursing's job is basically to be there during the insertion. There is one very, very important piece that needs to be done before inserting the ICP catheter into the bolt, and that is zeroing. Remember, with this particular setup, the Camino with fiber optics, these things get zeroed just one time ever. They will be zeroed once prior to insertion and then never again. Tuck that away. So in order to zero it, it has to be hooked up to the Camino. So this piece here, we'll bring this over to the Camino. You'll want to turn it on by pushing the start-stop button. Let it do its little self-check. I'm going to grab the end of the preamp cable. So this right here is called the preamp connector, and it connects up to here like so. So pretty easy, pretty simple, just plugs in right there. The thing about this, I told you about the sterile towels earlier. The thing about this is that because these cables obviously are not sterile, the physician will be sterile, there's going to be a little finagling here. So you might want to grab some sterile towels once this is connected and once it's zeroed, and wrap this connection up to maintain sterility of the sterile field when the physician is working. Now we're talking about zeroing. So this has to be zeroed prior to insertion. This little screwdriver, also called a key, is what the physician will use to zero it. So at this little notch right here, this is where the key or screwdriver goes, and the physician will very gently turn this until, if you come up here and look at the Camino, we're trying to get this ICP right here reading 0. It's very, very fine movements. You can see I'm moving it very, very little, and it's moving quite a bit. So they'll work with this until they get that exactly at 0 before they put it in. We're going to pretend I got it to 0. So once that says 0, they are ready to insert it. This key or screwdriver, once it's been zeroed, it needs to be thrown in the garbage because we don't ever want to zero it again. If it's zeroed while it's in the head, then it doesn't work anymore because it's been zeroed while it's in the head. So this can go, it can be thrown away. We don't need it anymore. So back to the bolt. The bolt is now secure in the patient's skull. And the physician will take the ICP catheter and insert it through here. It'll come through the end. And the physician will have this all measured out and stuff. It's not anything that nursing needs to know. But they'll get it into the right depth, and then they'll twist here to lock the catheter itself into place from moving. And then this protective covering right here will pop into place. Okay, so now this is in, it's inserted. One of the most difficult things about bolts, ICP bolts like this, is that there's no way to secure them. After they're screwed into the skull, there's no way to suture it, there's no way to tape it well, there's no way to secure it really well at all. So it is a bit of a challenge. You have to be very, very careful with these. Fiber optic catheters, just with the fiber optic pieces of them, they can break really easily, so great care, very gentle care of these is required. Okay, so that is the ICP catheter only. Once that is inserted and put together, that's it. That's all nursing needs to do for the general setup. It's pretty much done. Once we get that part in, then we go up to the Camino. So remember, we have this pressure cardioid plugged into that bottom channel line of the bedside monitor. And then this has its own pressure cable. You do not need to get a separate pressure cable for the Caminos. It has its own. Okay. So this is going to plug into your pressure cardioid, just like they normally do. And now we're going to take a quick second before we move on to talk about all these different pigtails that are hanging off here. These we do not use. They will not be connected to anything. We don't use the functionality that these offer. Similarly, down here by the preamp cable, this little part is the temperature connector. So we do not stock Camino fiber optic catheters that are capable of measuring intracranial temperature, but that's what that connector would be for. So that will never be connected to anything either. So once we have the pressure cable hooked up to the pressure cardioid in the bedside monitor, now it's time to calibrate it. So really the ICP catheter only, that's all it's doing. It's measuring ICPs. It's not draining, it's not doing anything else. But in order to have the Camino, as it's hooked up to the bedside monitor, reading the same language at the same time, we need to calibrate it. Please do not get this confused with zeroing. Zeroing does not equal calibration. So calibration needs to be done once a shift or with any disconnect or anything like that. In the next video, we'll talk about disconnects and road trips and stuff. But for calibrating for the first time around, you'll come in here to your Camino and you'll push cal step until the ICP reads 0. So normally just pressing it once will get you to 0. You need to hold it down while it's reading 0. If you inadvertently push it too many times, it's going to keep going. Then you have to cycle up past 200 and get to 0 again. Hold it. The other thing you're going to do at the same time at the bedside monitor, so you either need to have your Camino on the same side or you need 2 sets of hands. You're going to push this 0 button right here, hold it down until the Camino goes through its calibration steps. You'll know it's done because then it goes right back to normal ICP monitoring. Now, this has a potential to cause a little bit of confusion. We use the 0 button for the calibration, but again, remember, calibrating does not equal zeroing. It's just the button we need to push to calibrate the Camino to the bedside monitor. And then once it starts reading the ICP again, you're set. So that is the entire setup for the ICP catheter only. Now we're going to move on to the ICP catheter with EVD. So the Camino is going to be set up the exact same way. You're going to grab the pressure cardioid, pressure cable goes in that. So everything with the Camino itself is set up in the same fashion. It's the setup of the drainage catheter that we need to review. So I'm going to move these to the side. And we'll grab the Camino with drain and our drain bag. So when you know that Camino is going to be inserted at the bedside, you need to clarify with the neurosurgeon, are we putting in a Camino ICP catheter only, or are we putting in a Camino with EVD? If they verify that you're going to be doing the with EVD, pull out the correct box, and we know this is the correct one because blue water drains, and we also have it labeled on here. The other piece that we need to grab is our drain bag, and that comes right here in a bag, 1 to a box. So the drain bag is similar to the ventriclear one in that it needs to be flushed before we set it up and before we get going with it. So once the physician starts drilling for the bolt is not the time to say, oops, I forgot to flush my drain bag. So this needs to be primed just like the AccuDrain tubing does. Now it's a little bit different. We're going to talk about the setup and the positioning of this bag in just a minute, but I'm just going to walk through the flushing piece of this first. Once I get it all untangled, which I probably should have done before we started. You're welcome. Take a drink of your pop or something. Okay, done. So we have the bag out. This should go on a pole. It must go on a pole. It can't go anywhere else. So hang your bag on the pole. Remember, this is before we get it hooked up to the patient, so it can be anywhere that's easy for you to get at and access. Now this comes, when we're flushing it, when we're getting ready to flush it, you're going to want to make sure that this stopcock is off so we can flush it into the Buretrol just like we do with the AccuDrain. Take a few seconds to take a look at all of these pincher clamps here. They should all be open. Okay, all of them are open. This one closes off the drainage tubing itself. This one is a vent